what do we get wrong when we think about pain? Is there something that we're just not understanding when it comes to the physiology and the root cause of pain? I think, aging, everyone will blame aging, like I mentioned. Some people will think that they did something physically wrong in their day-to-day activity or in a sport. Is that the true root cause of pain? Like, where is pain actually coming from?
Well, the funny thing about pain is that there isn't ever one true cause, especially when pain is chronic, meaning that pain has been around for longer than 3 months. A lot of that cause is coming from the brain or coming from your nervous system or coming from the expectation of pain or your relationship with pain. And the longer a pain is around, the less of a relationship it has to an actual mechanical cause.
Mm.
So obviously, if you make a quick movement, you rupture your Achilles, that is a one-to-one correlation. That's a mechanical cause. That's where your pain is coming from. But when it comes to a back pain that is very prominent in today's culture and today's world, and millions of people are dealing with it
Oh,
and
yeah.
have been dealing with it, I think a lot of what people tend to get wrong is they lose track of just how complex that pain can be. And they want to blame it on age, or they want to blame it on arthritis, or they want to blame it on one specific thing, especially something that's out of their control.
Mhm.
When in reality, pain is far more complex than that. And there's a lot more in your control than isn't.
So what is the root cause of pain then? Where is if we had to dial it down, right? When I sit with patients, I'm always like, okay, this is our starting point. This is like ground zero, of everything we're dealing with. Where's ground zero when we're talking about pain?
Ground zero would be, I guess, if you really had to pinpoint it, would just be how your brain is interpreting the threat that it's getting somewhere in the body. And so that is why people can have radically different pain tolerances to the same exact stimulus. It's because their brains are interpreting that threat as either something more threatening that deserves more of a pain response, or less threatening that deserves less of a pain response. So if you look at a chef that is used to touching hot things, dealing with hot things, I've seen a chef reach in and flip a chicken cutlet and
Oh, really?
ripping hot oil with their fingers.
Ah!
Sure, part of that is that they've done that enough to where they've built up calluses, and sure, they have a little bit more of a resilience in their fingertips, but also their brain has learned over time by doing that, that while their finger may feel a little hot and while it may hurt in the short term, they've kind of figured out that it is not an overly threatening thing that deserves a large pain response. Whereas if you take someone who has never done that before, their brain is like, that's the hottest thing I've ever touched in my life. This must be harmful. We deserve a high pain response so that we know to retract our hand, take it away, and so we don't do that again. And so the relationship with pain has far more to do with how much pain you feel than at the actual mechanical stimulus.